So, honorable senators, on this issue, I want to guide that on KEMSA issues, I hope you are still the chair for health, isn't it? Or there is some guidance I wanted to give through the committee of this House on Health. Because so what I want to guide is on these KEMSA issues, the Committee on Health of this Senate to follow up with the CS, Senator Ndamo Lekina, the ministry will be very happy to benefit from innovative ideas that you have. So anytime you can approach even the ministry, sit down with the team, and also offer solutions to this country. I'm happy that we are giving solutions, and that is the way to go. Because we always complain and say things are not working. Then how do we make them happen? As leadership, as leaders, I'm happy that now we are giving solutions. So the Senate, through the Committee on Health, should be able to follow up on that report on reforms to do with the KEMSA, because that is where the problem is. And Senator Ndamo, I think you are a member of the Health Committee? Yes, definitely. Now you have that opportunity to really team up the committee, the entire committee, so that you can be able to really discuss these issues and bring the report to this House. But I want to give the Senator Mandago, what is it that you really want to say? Because, Honorable Senator, let us go to other questions so that also we can get that opportunity to interact with the CS.
Thank you very much, Honorable Speaker. My supplementary mine is a question to the CS. Whereas counties owe KEMSA, but also national government through Ministry of Health owes KEMSA. Why are you not releasing, if you have been given 25 billion in the budget, why are you not paying your bills also to KEMSA? And you are the ministry responsible for KEMSA. So you cannot be shooting yourself on the foot, saying that counties are not paying while the ministry are doing. What are you doing as a ministry to pay also your obligation? And finally, Honorable Speaker,
One question, please.
As a chair, just allow me only one second.
Chair, you have all the time with the ministry,
They don't know our summons. When this ministry has a lot of contempt for the Committee of Health of the Senate. That is it. But it is okay. If that one question is sufficient, we shall sit down.
You know you have that under very sensitive matter when the CS is here. What did you say? What is it you want this House to help you to do?
Honorable Speaker.
Because you are the one I'm tasking to follow up these KEMSA issues. And then you are still again.
Yes, but we are also telling you as it is. Honorable Speaker, sorry, Honorable Speaker, allow me to say this. Health is about 90% involved. But the involvement of the ministry in the Committee of Health of the Senate is 10% of the involvement. They have a preferential treatment of working with National Assembly as opposed to working with the Senate. Honorable Speaker, you are aware we had our midterm review of the Senate activities for the last session. We have only 2 years as a committee to help this government to make sure that UHC is properly rolled out, benefits Kenyans. Did you see any of the Ministry of Health officials in Naivasha when we had our review as a whole Senate, not as a Committee of Health? So, Honorable Speaker, when we say as a committee we are frustrated, the majority leader knows. I had even asked him to stay away from chairing the Senate Health Committee because I don't want to be associated with failing. When we have a whole committee that is willing, they are committed, they have innovative ideas. You have heard what Senator Ledama said. And we are willing to make our contribution and our ideas and innovation on how we can make these things work. Honorable Speaker, you know I'm a governor emeritus. I've also run health for 10 years. The ministry can benefit from my experience as a governor on how we can handle issues of pending bills in the county. But where is the opportunity to have this discussion?
Senator Mandago, those are very valid concerns. And as a chair, it's really not, it does not sit very well when the CSU are here and the chairman of health is complaining that he's not able. And the whole team, you can understand and appreciate the ideas coming from the Senate. Yeah? And our concern is really on devolution to work. And that is our core constitutional mandate. So if the chairman of health is here complaining, lamenting that between you and them there is a disconnect, and you see from the chair I'm giving guidance on what should be done on KEMSAT, the reports and all these things. Does it even also the directives that I'm giving will not be implemented? So I think give your commitment that you will really work with the Committee of Health of the Senate. Give that commitment while you are here today.
Yes, Honorable Speaker and honorable members, we want to inform you we acknowledge and we really send our apologies for that. For the three that we have been summoned, we've been able to go for 2 meetings, which were quite fruitful, and we were able to pick some very critical concerns that we addressed and some very innovative ideas that we were able to implement. And so we really, really, as I said earlier on, appreciate the work of the Senate, and we want to really collaborate together to ensure that Taifa Care becomes a success. So out of the 3 we attended to, we missed one. That was because of our cabinet meeting, and I shared I shared the same with Senator Mandago. But moving forward, we want to assure you that we'll be working collaboratively. Indeed, health is devolved, and these are critical things that we need to look into to ensure that we have successful implementation of Taifa Care. So we apologize, and we assure you that you will not see another incident like this.
On the mid-term review of the Senate work, you went there afternoon scheduled for you during that retreat, and still you have not presented your paper to us. Maybe you must get your time to engage the Senate. You come on a free Kamkunji and engage the Senate, either through here or any other place, so that also can present your issues, and also senators will be able now to interact with you and also help your ministry to serve Kenyans better, especially to make sure that our hospitals in the counties get the necessary attention that they need. So another commitment, find your time through the majority leader is here, through the clerk of the Senate, so that you can also get your time to present the issues that you are to present in Naivasha 2 weeks ago. Let's go to the next question. Senators will get an opportunity still now to interact with your question. All these health issues are just the same. If you listen to the Senator Wambua's question, or questions, they are interrelated with the issues that you are raising on this front. Therefore, so, Senator Manzo, what did you say initially?
Do it in one sentence. So, Mr. Speaker, I was just simply asking, if Senator Oladama gets a seizure and I'm seated next to him, what will I do? And this for benefit of you and the rest of the community, as a medical doctor. I mean, a lot of people get seizures, people run away from them.
When I was in school, we used to have, you can put a spoon so that it doesn't cut the tongue. But the CS, you can advise Senator Manzo what to do when he gets somebody with a seizure. What should he do?
Thank you. So we have our ABCs of resuscitation. We have guidelines and curriculum for first aid management, again for resuscitation of cases. And again, we have various bodies that support in training on the same. And so as a ministry, we have placed the curriculum and guidelines for first aid, including management of seizures. And I believe that moving forward, we'll be able to strengthen that and improve our monitoring and evaluation to ensure that all Kenyans are informed on how to conduct first aid for patients with seizures.
Senator Manzo, when those sensitization dates are given, you must avail yourself for that training. So let's go to the second question by Senator for Kitui County, Enoch Wambua. Senator, as you know, it is where I sit, there are so many things we do, consultations. Senator Amina Kibwana, I know you have a question and you'll be able to ask. No problem.
I thank you, Mr. Speaker. Mr. Speaker, I see my brother, Senator Wakoli, in a deep conversation with the CS, which is a good thing. I'm sure he is briefing out on a few things. Mr. Speaker, I will ask question number 10. But Mr. Speaker, before I do that, because my gadget was on for a long time, to raise an issue or two on previous questions. I will raise them, and the CS does not need to respond. I will just raise them, and I will continue with my question. The Speaker, one of the issues that I wanted to raise was the issue that was raised by Senator Olekina. Clearly, Mr. Speaker, we have a problem. And you know, Mr. Speaker, one of my biggest weaknesses is to say things as they are. We have a big problem. One of the biggest problems that we have is when people want to answer their own questions. You know, I ask a question, but you want to answer your own question. Mr. Speaker, Ledama asked a very leading question that would really have helped us as a country in terms of management of healthcare.
Senator Ombo, I gave very clear guidance on the matter.
Mr. Speaker, please hear us out, Mr. Speaker. Just listen to senators. Mr. Speaker, this is out of debate. If you want to put us in a straitjacket, we will not fit there.
This is now not a debate time. Of course, you know, you have a question that we're supposed to answer.
Yes, Mr. Speaker, and I say that I had raised a point
and
that
I placed that matter on the committee on health. Why should we go back to
I don't see that committee, Mr. Speaker. Just allow me, if you will. Mr. Speaker, there are different ways of managing healthcare, not just in Kenya, but across the country, across the globe. You could lease equipment, you could do direct procurement, you could do managed equipment scheme. And Senator Ledama brought up a very important issue of placement. And that's where we get help, Mr. Speaker. Where manufacturers could actually place medication in hospitals and the drugs are released to patients on prescription and paid for upon use. So that when the drugs are expiring, the manufacturers bear the responsibility of withdrawing their own drugs and the hospitals do not suffer over expiry. Mr. Speaker, I'll go to my question because I see a level of impatience on your part on this matter. Mr. Speaker, I want to ask the Cabinet Secretary for Health. Question number 1. How much money in terms of contributions was in the accounts of the National Health Insurance Fund at the time of transition to the Social Health Insurance Fund, SHIF, and could the Cabinet Secretary state the banks and bank accounts in which the money was held? Question number 2. Has the money been fully transferred to the Social Health Authority accounts? And if so, could the Cabinet Secretary state the banks and bank accounts into which this money has now been deposited? Question number 3. How much money has been collected from contributors since the advent of SHIF? And could the Cabinet Secretary state how much has been utilized for the benefit of contributors, their beneficiaries, and other eligible Kenyans? The last question, number 4. What measures are in place to ensure that the money is not misappropriated and the contributors, their beneficiaries, and all Kenyans are not denied access to health care?
Madam CS.
Honorable Speaker, honorable members, the Social Health Insurance Act number 6 of 2023 came into effect on the 22nd day of November 2023, hereby repealing the NHIF Act number 28 of 1998. As at 30th September 2024, NHIF bank accounts held a total of 1.4 billion, as tabulated on the table below. Honorable Speaker, honorable members, with regards to the transfer to the Social Health Authority account, the commencement of the Social Health Insurance Act marked the beginning of the transition period from NHIF to Social Health Authority for a period of 1 year as stipulated by the Social Health Insurance Act. And during the 1 year transition period, NHIF continued to receive contributions and offered services on behalf of the Social Health Authority as per the NHIF Act up until 30th September 2024. On 1st October 2024, SHA took over the operation of NHIF. However, all the pending claims are still being processed and paid under NHIF. The monies in the NHIF bank accounts are being used to pay for pending claims and other payments incurred by NHIF. The fund paid NHIF claims are shown as in the table below, totaling to 8.6 billion. There's claims payable amounting to 24 billion as of 25th February 2025 for hospital claims, Linda Mama, capitation, and group life. The balances in the NHIF bank accounts are as follows, totaling to 11.2 million. The management froze all the NHIF collections accounts in the month of November 2024 to ensure seamless transition of collection to the SHIF accounts. And SHA is now in the process of closing the accounts except for one that management has resolved to maintain for collection of NHIF late contributions from employers and government institutions paying NHIF debt, such as civil servant medical scheme arrears, as well as receiving penalties from employers. Regarding Part C of the question, Honorable Speaker and honorable members, SHIF was rolled out on 1st October 2024 to receive contributions and provide medical services as per the SHI Act. SHA management opened bank accounts as per the approved list by the board and the National Treasury, and the table, as you can see, shows the breakdown of contributions received under Social Health Insurance Fund as of 31st January 2025, which is 20.9 billion, and you can see the breakdown from the table below. Regarding the claims, the total claims paid to date are 18.2 billion, out of which 16.9 relates to Social Health Insurance Fund claims and 1.3 relates to the primary health care capitation and is also shown in the next table. The measures that are in place to ensure that the money is not misappropriated and the contributors, their beneficiary, and all Kenyans are not denied access to health care. Honorable Speaker, honorable members, the management has instituted proper internal controls to safeguard members' contributions by ensuring, first of all, that the development and implementation of a new system for the purposes of SHA is operational. Secondly, the opening of designated bank accounts for handling Social Health Insurance Fund, primary health care, and emergency chronic critical illness funds, as well as SHA operations. Thirdly, the implementation of Section 42 of SHI Act that restricts SHA administration expenses at 5% of the collection. And fourthly, implementation of a standard benefit package and tariffs, thereby removing subjectivity in payments while ensuring predictability. Again, data cleaning through fresh registration to generate accurate beneficiary.
Hurry up, agent. Only 20 seconds left.
Ongoing.
But which wire should I cut?
The red or the blue or...
Usually it's always the blue one.
Yes, but there's also a green one and a yellow one.
Hey, behind you. Red Bull. Drink it. Now.
Indeed. Too late.
Well, no Red Bull, no wings.
Which states that the fund shall not provide enhanced benefit schemes and packages insulates against the losses of the enhanced schemes.
Senator Enoch Wambua, you have the opportunity to seek for clarification on the supplementary question. I don't know if the senators, this response has a lot of figures as tables, so I hope you have the response. If you want to go for interactive enough copies here. Don't have the copies here,
Mr. Speaker, I will skip the tables and the figures because I've just seen them now. And because you have said there will be engagements going into the future, then perhaps you can transact that business elsewhere. I will go straight to my two supplementary questions. Madam CS, my appreciation of Shah and Chief as a Kenyan, now not even as a Kenyan, is that what your ministry is doing is trying to climb a tree from the top. That's my honest response to Shah and Chief. Why? Because under universal healthcare, and this is not a Kenyan program, it's a global universal concept, supposed to facilitate access to affordable, promotive, preventive, curative, rehabilitative, and palliative care to patients when they need it. And for that to happen, two things are important. One, infrastructure development in terms of just physical facilities and equipment within those facilities. That's infrastructure. And the second one is personnel. You know, doctors, nurses, clinicians, support staff, to make sure then that it forms the basis of rolling out UHC. Madam CS, you want to tell this country, of those two important facets of the success of UHC, what did the government do for rolling out SHA to ensure that we have, one, enough facility infrastructure, and two, we have sufficient personnel to deal with the demands that come with UHC? Secondly, my second supplementary question is a live matter. You and I and Kenyans are aware that private and faith-based health facilities are withdrawing from the SHA for reasons of funding, release of funds to the facilities. I saw yesterday the CEO make a very irresponsible statement saying that there are only 300 facilities, so even if they disappear, nothing will really change. Madam CS, you and I know, Kenyans know, that those only 300 facilities could be the only facilities available to Kenyans, especially in far-to-reach areas. So the withdrawal of services by those facilities is actually a death sentence to millions of Kenyans. That statement coming from your CEO, Madam CS, I would have expected a rejoinder from you immediately to say that you care if you do. Madam Speaker, Madam CS, what are you doing to win the confidence of the faith-based and private health facilities to make sure they come back on board and continue to offer services to Kenyans, especially to far-to-reach areas? I thank you, Mr. Speaker.
Okay. Madam CS, answer the two supplementary questions.
Thank you very much, Honorable Speaker and Senator Wambua. Affordable, accessible, quality care is indeed critical. This universal health coverage, and in our country, Taifa Care, has been implemented. It's part of the Sustainable Development Goal. It's part of Africa Union 2063. We've had multiple guidelines from various bodies, including the World Health Organization, and in terms of implementation of universal health coverage. And so this is not something that the ministry just sat behind the bench and looked into. What we reviewed is data, publications, research, and other implementations, best practices from various countries, including Thailand, on how they were able to make UHC a success in their country. And so for us, it's indeed critical, because even as you look in various countries, you observe that they raise concerns and grievances, first of all, on waiting time, second, on the system interruptions. So this is a common issue. But one thing that cuts across board when it comes to UHC implementation, what all the countries that have implemented talk about is that it is better than nothing, because they know that if each and every one of them can access services, then the country will move forward, and we will not have a catastrophic expenditure when it comes to health service delivery for our people. And so, indeed, it is critical for us to really embrace UHC as a country and ensure that we are all in the same page. And that's why, again, we really emphasize on collaboration, even with the Senate and among other stakeholders, to ensure that it is a success. And so we take note of the infrastructure and equipment, and you'll notice that part of our pillar is the health products and technology within the pillars of UHC. And in this, we have the NEST project, the National Equipment Service Product, where we've had multiple counties, sign the agreement. And again, that is around 45 out of the 47 who have signed the agreement, and 36, again, who have listed down the equipments that they need within the facilities. And so it is an area that we look into. Now, you will also observe that within our country, what we are seeing is we are building shells, we are building structures, infrastructure, but we don't have the services needed. We don't have human resource, we don't have health products. So again, we really need to balance, and that's why as a ministry, we went back and reviewed what is critical to ensure that human resources are there, to ensure that health products are there for the patients to see. Those are really the critical components that we are looking into. And that's why we really need some time to look at the comprehensive report and see how we are working together with KEMSA to ensure that there's recapitalization and ensure that medicines are reaching, or the commodities are reaching to the last mile, because that has been a challenge. And especially in level 2 and 3, the dispensaries and health centers, where you observe that there is no medicine, and now people are moving towards the higher levels of care where they say their equipments and health products. And again, that brings a lot of challenges, because now they become congested and they cannot. That's why, as a ministry, we went back and reviewed what is critical to ensure that human resources are there. Our health centers, and we have our dispensaries, having human resource, having medications. That way, people can be able to access services. And that's why we really need your support even moving forward. And so with regards to health products, we will have a comprehensive report. For infrastructure and equipments, we have the National Equipment Service Program. And again, with regards to human resource for health, we are looking towards having more human resource for health within the program, and ensuring that they are running and supporting this initiative. So the personnel is not out of it. It's part of our action plan to ensure that the services continue. Again, we continue to support in the building of health centers as a country, and we continue again to ensure that they are functioning. You will notice even in our annual plan and our budget, we are supporting in the development of health centers, but really emphasizing that it is not just a shell, it's not just a building. what we need is the services. And for the services to be there, we need health products, we need human resource, again, in that platform. So the private and faith-based organization, we do take note. We are acknowledge that they are really a critical pillar in ensuring that health services are delivered to all Kenyans. And so we continue with our partnership with the private that health products are there for the patients. So those are really the critical components that we are looking into. And that's why they really need some time to look at the comprehensive report and see how we are working together with KEMSA to ensure that there is recapitalization and ensure that medicines are reaching, or the commodities are reaching to the last mile, because that has been a challenge. Together with the social health especially in level 2 and 3, having the dispensaries and health centers where you observe that there is no medicine for the, and now people are moving towards the higher levels of care where they are engaging various MDs that were involved. And again, that brings a lot of challenges to ensure that there is payment. They cannot, that's why, as a ministry, we went back and when we have our health to ensure that human resources are there, our health centers, and we have our dispensaries, having human resources, having medications. That way, people can be able to access them services, and that's why we really need your support even moving forward. And so, with regards to health products, we will have a comprehensive report for infrastructure and equipment. We have the claims management, which has been addressed currently. And again, the challenge again that is really we are facing is the NHIF debt. So then once we have addressed that, I believe that we will be in a position to ensure that UHC is implemented. So NHIF debt was number one. Number two was the primary health care fund, which again they had not, some of them had not grasped the concept of the global funding. And so what we have done is that we are meeting them to explain to them and really tabulate what it means for them in matters of the new form of the primary health care funding model. And what you'll see, it's actually of benefit to them, because while previously in NHIF they were only covering around 7 to 8 million Kenyans, we are having universal. So we are having more Kenyans on board, so more services to Kenyans, and so more revenue collected in this. And so it's really explaining to them how the calculation is done for them to understand that they are not going to lose, they are getting more even through this system. And so we are reaching out to them to ensure that discussions are ongoing, and our partnership as the our partnership with the ministry and the private and faith-based organization continues, because we really need to have their services so that they can be accessible to all Kenyans. So we will honor the bill, we acknowledge, and we are having a payment plan for NHIF.
Next is Senator Seki Lenku. Are you not satisfied? You went two supplementary questions, which she has answered.
Thank you, Honorable Speaker.
Unless if you are not satisfied, then I'll give you an opportunity to get clarification.
Okay.
Senator Seki.
Speaker, I'm not satisfied with any of the responses that have been given. On the first one, Speaker, then the CS should just go on record. This is the Senate. This is the floor of the Senate. Just go on record and say that you are not ready for UHC. Because in so many words, that's what you're saying. You're saying you don't have infrastructure. You're saying you don't have personnel. Just go on record and say that as a country, we were not ready for the rollout of UHC. You cannot tell the sick nation that you are putting money to build hospitals, you're looking to recruit staff. That should have happened before you rolled out UHC. So just go on record, be clear on that. On the issue of the faith-based facilities, Mr. Speaker, what baffles a lot of us is that This is already realized revenue.
We went back and we put it back to health to ensure that human resources are there. Our health centers and we have our dispensaries having human resources, we are having medications in that way. People when you engage them services, and that's why we really need your support even moving forward. And so ensuring that health products is done a comprehensive report, the time infrastructure and the challenge we have the claims management, which has been
whether she can benefit from the other team, the PS and the Director for Medical Services. Maybe if she is consulting, then you can suppose.
Maybe then that's the guidance you should give us.
And again, the challenge again that is really...
That when we see her asking a question, then we stop.
Yeah, that's what
Otherwise, who are we addressing?
Maybe you can pause and then you could now proceed.
This is very interesting.
Supplementary question. So,
Mr. Speaker, let's just agree that this is a very important issue. This is not about even anyone. Mr. Speaker, on the issue of the private and faith-based facilities, the CS has said that there's a plan, and I'm saying this is already realized revenue. It's not money that they are supposed to be going to look for and pay. It's realized revenue. The Speaker, as I sit down, what I want the CS, myself, and everyone in this House to realize is that we can speak in the comfort of this city because we have hundreds of facilities around us here. The Speaker, in real Kenya, in the marginalized areas of Kenya, the faith-based organizations and private institutions are a lifeline to all the people in those areas. When those facilities are not offering services, then there is no UHC that is taking place anywhere. Mr. Speaker, I want the CS to respond to real issues, not literature, Mr. Speaker. We are not talking about data, real issues. I expected her to tell us, Mr. Speaker, when we were closing down on NHIF to go to UHC, we had X number of facilities. At the time of rolling out, we had increased the number from X to X plus 1,000. We had X number of doctors. We increased the number from X to X plus 20,000. Those are the figures that are expected, not literature, Mr. Speaker. I thank you.
Yes.
Thank you, Honorable Speaker, Honorable Members. So, yes, so UHC is a journey. Implementation of UHC is not a one-off, it is a journey. Right now, when you look at even countries like UK, which has been able to implement NHS,
Senator
challenges
Abu,
are again...
You are listening to the response. This is your response.
You observe that the challenges are still present. They talk about human resource for health, and you can see even for us as a country, we are having our nurses and some people going there. So it is a journey, and we have to start somewhere. And our priority was to ensure that all Kenyans are registered. That way they can be able to access services. And so this is a priority to us, registration. Additionally, health financing, ensuring that contributions are
Mwaka 2022 hii pwani ilifunga milango kwako, na kila mpwani viongozi wengi wa pwani, kila mtu alitoa bunduki lake na silaha kusema kwamba usiingie pwani. Wa kwanza alikuwa ndugu yangu Mhenga Hassan Joho, wa pili gavana wangu wa Kilifi, na wengine wabunge wengi. Lakini ulipoapishwa kama rais ulisema kwamba wewe hubagui. Pale ulitoa kura nyingi, pale ambao hukupata kabisa upeleka maendeleo sawa, mapana na marefu ya Kenya bila kubagua yoyote. Mwenyezi Mungu Rais akupatie baraka. Nataka nikwambie nikiangalia mbele hivi kisiasa, naona bunduki la Mheshimiwa Joho mliweka chini. Naona bunduki la gavana wenyu wa Kilifi ameliweka chini. Naona bunduki la Amina Mnyazi alotumia kumpiga Mheshimiwa Ruto ameliweka chini. Mheshimiwa Rais, una bahati kubwa kwa sababu mwaka 2027 zile zana za vita zilizotumika kukupora mawe sasa zimeweka katika gala, tumezifungia. Unakaribishwa Pwani na utaona maajabu mwaka 2007. Asanteni sana, Mwenyezi Mungu atubariki.
Asante. Naomba tuwe wafupi kwa sababu rais ameshaongea. Taja tu mawili matatu tumalize kwa sababu rais ameshaongea. Naomba vijana tutulie. Naomba tutulie, waliobaki tuwe wafupi. Wacha niite mbunge wa Malindi, Mheshimiwa Amina Mnyazi.
Malindi hoye! Sabaki hoye! Ni raha masiraha! Ni raha masiraha! Mimi nataka nishukuru sana kufika kwa Mheshimiwa Rais, Mheshimiwa Deputy President na mawaziri wote wenye ambao mmefika hapa. Mheshimiwa Rais na Mheshimiwa Deputy President, leo hii mimi nimevaa kofia mbili. Mimi ni mbunge wa Malindi na mimi ni mbunge wa Magarini mpaka pale ambapo patapatikaniwa mbunge wa Magarini. Kwa hivyo mimi nataka niseme hivi, nianze na kule kwangu Malindi. Mheshimiwa Deputy President, ulipokuwa waziri wa Interior, nilikupigia simu nyingi sana na tukazungumza sana kuhusu masuala ya usalama ndani ya Malindi constituency. Usalama umezoroteka. Kuna watu, Mheshimiwa Deputy President na Rais, wanaita wa mawoza ambao wanasumbua watu usiku na mchana. Na Mheshimiwa Rais, ili tuweze kutatua shida kama hizo, niliweza kukuomba magari ya mapolisi. Pale Malindi tuko na police post 8. Lakini jambo la kushangaza na la kusikitisha, tuna gari moja peke yake ambalo linatumiwa na mapolisi. Kwa hivyo hawa mapolisi tusipowasaidia na usafiri, hali ya usalama isitazidi kuwa mbaya. Tunaomba mapolisi wetu, zile gari ambazo mnakwenda kupurchase, mtuweze kutuwekea magari 8 ndani ya Malindi constituency. Lengine, Mheshimiwa Rais, nafikiria waziri hapa Alfred Mutua amelitaja. Alipokuwa yeye ni waziri wa tourism, alikuja huku Malindi, akaweka mkutano na tukamwambia watalii hawawezi kufika mahali ambapo hakuna mataa. Ndivyo ama sivyo? Na hata sisi kama watu wa Malindi tuko na haki ya kuweza kuwekwa stima barabarani mwetu. Na uliweka wewe, najua proposal. Sasa sijui vilikwendaje mpaka leo zile taa bado hazijawekwa ndani ya Malindi yetu. Na waomba kwa heshima kwamba ile proposal yenye ambayo tulikuwa tuko nayo tuweze kuirudisha. Mimi nataka pale Malindi, ukiingia Msabaha, ukienda mpaka Marine Park, tukienda mpaka Mambrui, tuone mataa yameng'ara Malindi na Magarini kwa sababu ya usalama, kwa sababu ya utalii ya watu wetu hapa ndani ya Malindi na Magarini. La mwisho kuhusu Malindi ni kuhusu masuala ya airport. Nyinyi wenyewe mnajua mambo ya airport tumeyaomba kwa muda mrefu. Na hivi sasa tunaomba chini ya uongozi wako Mheshimiwa Rais, let this dream come true. Masuala ya airport tumekuwa tukiyaimba kwa muda mrefu. Na najua Mheshimiwa Rais, you are on top of matters. Ni juzi tu tulipoteza watu wetu 3 pale Malindi Airport. Na hatutaki kuona jambo kama lile likirudia tena. Mheshimiwa Rais, nakuomba, one of your legacy projects ndani ya Kilifi County, tufanyie swala la Malindi International Airport. Nikitoka kule Mheshimiwa Rais nije hapa Magarini. Na nafikiria ya Magarini amekuwa mwerevu, ameyataja Mheshimiwa Rais. Mmemsikia? Si mumemsikia? Mheshimiwa Rais, watu wa Magarini wanasema hii barabara imeundwa iko sawa sawa, lakini haina bumps. Kwa hivyo vijana wengi wanateseka, wanapata accident kwa sababu ya hali ya hii barabara ilivyo. Kwa hivyo watu wa Magarini wanaomba bumps ziweze kuwekwa. Kuna ile kampuni ya Crystalline Salt, Mheshimiwa Rais, ambao tayari umeigusia. Na hawa wananchi walikuwa wamenituma tuiseme. Na kwa sababu nimetumwa, mtumwa hauawi. Hawa watu wa Crystalline wamekuwa kitatizwa na watu wa Warma. Na hawa wananchi wa Magarini, kile kitu ambacho wanakitegemea kitega uchumi ni ile chumvi yenye ambayo iko pale. Hii kampuni ikifungwa, hawa watu wangu hawa watakwenda kupata kazi wapi? Kwa hivyo tunakuomba Mheshimiwa Rais, vile ambavyo umetuahidi uweze kuingililia katikati, ile kampuni isifungwe na watu waweze kuendelea na maisha yao. La mwisho, kuna barabara ile ya Ngomeni. Mheshimiwa Rais, hiyo barabara pia nayo tuliyazungumza na watu wa San Marco, wamefika, contractor akaja, na hivi sasa hatuoni kazi yoyote yenye ambayo inaendelea. Kwa hivyo kwa heshima Mheshimiwa Rais, tulikuwa tunaomba kwamba uweze kuzungumza na watu wa San Marco tena, ili yule contractor aweze kurudishwa pale, ili kazi iweze kusonga mbele. Na sisi tumesema hayo yote, lakini ni appreciate kule kwangu Malindi, Mheshimiwa Rais ananiletea mimi Huduma Center. Mheshimiwa Rais, kule kwangu kuna masoko mawili ambayo moja linaletwa pale Shela na lengine linapelekwa kule Ganda. Nimshukuru Mheshimiwa Rais na Mheshimiwa Joho. Kuna project yenye ambao tunafanyiwa pale Malindi Fisheries kwa kupitia serikali kuu. Na nimshukuru pia Mheshimiwa Rais, kuna project ya 100 million ambayo iko pale Malindi National Marine Park ambayo ni ya marine research, inafanyika pia ndani ya Malindi. Kwa hivyo kwa hayo machache, asanteni sana, na mjue ya kwamba tuko katika broad based government. Kwa hivyo saa hizi mtu akinichokoza tu, mimi mbio kwa rais nenda kumsema.
Women rep haraka tafadhali.
Mheshimiwa Rais, kwa heshima yako, mimi nitafanya summary tu, tukushukuru kwa sababu ya kutuletea moto. Lile nitakalo kuomba ambao tumezungumza hapa na Mheshimiwa Speaker Amason Jeffa Kingi, hii barabara lazima iwekwe lami mpaka ishikane na lami kule juu. CSR hii ifanywe na Kenya Power kwa heshima ya sub county hii. Sabaki hoye! Mambo ya mashamba, Mheshimiwa Rais, mimi nitafanya summary. Summary yangu iko hapa. Hapa kwa Ndomo kuna shamba M52. Kweli uongo? Wanataka haki yao. Wanataka title deed. Kuna M52, M16, M13C kule baharini. Kuna bwanyenye ataka kukuchukua. Kweli uongo? Tupate haki zetu, tusipate. Malindi ADC, Mheshimiwa, kuweze kulimwa pale kwa ile shamba ya ADC. Kisa kimoja Mheshimiwa Rais ambacho cha kusikitisha, shamba lile na msitu, kuna mama mjamzito alibakwa kwa lile shamba. Tunakuomba upeane ruhusa kuweze kufyekwa pale, shamba ile we clear na watu wa Sabaki wapate haki yao. La mwisho Mheshimiwa Rais, uliahidi wanafunzi wa Ngomeni milioni 3. Wamenituma wale wa Ngomeni, ahadi yako utimize. Asante Mheshimiwa Rais, tukushukuru. Tutafanya kazi naye, hatutafanya. Uzire upate hukose kisha upate vision ndozo shozo. Karibu sana Mheshimiwa Rais Kilifi. Asante sana.
Malizie, nasikia kuna MCA wetu hapa. MCA 1 minute. MCA wa area ni mama.
Kilifi hai! Mheshimiwa Rais, tunakushukuru sana siku hii ya leo kwa kutukumbuka. Tunashukuru kwa kutuletea hii power station hapa. Kitu ambacho tunaomba kabla haijaanza kutambaa mali kwengine, sisi tutosheke na moto hapa Sabaki. Kitu chengine, Mheshimiwa Rais, ni kuhusu mambo ya mashamba. Unajua sisi kama MCAs, sisi ndio tuko ground. Sisi ndio tunajua shida zote za wananchi wetu. Mheshimiwa Rais, hii ADC tunakuomba, kwa sababu ilifanyiwa tayari petition, tunakuomba Mheshimiwa Rais, tupatie angalau 40% ya hii shamba. Wale masquatters wote ambao wako hawana mahali pa kuishi, at least wapate mahali pa kukaa. Hiyo sehemu nyingine, Mheshimiwa Rais, chukua hiyo sehemu ambayo itakuwa imebaki, eka affordable house, eka na vitu za serikali pia hapo ndani, ili ziweze kusaidia vijana wetu wa Sabaki. Kitu chengine, Mheshimiwa Rais, sisi ni masquatters huku, tunaomba hizo title deed. Tunaomba hizo title deed. Niko na mengi ya kuongea, lakini hapa Mheshimiwa Rais, niko na memorandum yangu imebeba kila kitu. Nitakuachia usome uelewe vizuri.
Hey! Yaani sasa kumbe hawa watu wametusumbua sana, wamepangwa na mama huyu Lakini si huyu mama amejipanga. Huyu MCA amejipanga. Basi huyu ni kiongozi ambaye anajua mambo ya kupanga ground. Kwa hivyo yale mambo yote mmeyasema hapa, mimi nataka niseme asante sana watu wa hapa Magarini, watu wa Sabaki. Mimi nawashukuru sana, na nimekubali ya kwamba hii stima ianze na hapa Sabaki na ianze na hapa Magarini. Maneno ya ardhi nimeyasikia kwa makini. Mambo yale mengine yote nitayashughulikia. Nimesikia Amina Mnyasi amesema hii barabara mnataka iwekwe bumps. Kweli nyinyi ni wasumbufu bwana. Barabara haijajengwa, barabara mbaya yatengeneza. Barabara imetengenezwa, hapana inakimbia sana, weka bumps. Bwana. Sasa na sasa mnajua lazima kwanza tumalize hii barabara, kwa sababu tulijenga ikakwama mahali inaitwa Sosoni kule. Nataka niisukume ifike mpaka Baricho pale kwa daraja. Nikishakamilisha hapo basi nitakuja kuwawekea hizi bumps. Si ndio? Na ile mambo ingine yote mmesema ni sawa. Sawa sawa. So otherwise mimi nataka niseme asante sana, shukurani sana kwa kutukaribisha hapa Malindi. Mimi najua hapa kwa mapenzi ya Mungu tutachagua mbunge mpya, sio? Na tuko na wanaume wanasukumana hapa. Si ndio? Tuko na huyu Stanley ako area atatafuta hiyo kiti. Tuko na Michael ako area pengine akatafuta hiyo kiti. Tuko na nani mwingine? Kalama ako area atapambana na wao. Lakini si mafundi wa kuchaguana ni nyinyi. Na nyinyi mnajua kupanga mambo. Bas hawa wote tutapangana na wao, ni wetu. Kwa sababu sasa mambo ni broad based. Sawa sawa?